India records highest single-day spike in COVID-19 cases and deaths. 9,304 COVID-19 cases and 260 deaths reported in the last 24 hours. Total COVID-19 cases in India stands at 2,16,919. Active COVID-19 cases in India stands at 1,06,737. Total COVID-19 related deaths in India is currently at 6,075. This is the big news that we are currently tracking. 9,304 COVID-19 cases and 260 deaths have been reported in the last 24 hours. And this is the highest single-day spike reported in India, and taking the total tally 2,16,919 in the country so far. Well, for more details on this, I'm being joined in by my colleague Abhijit from the newsroom. Abhijit, for the last 3 to 4 days, we have been seeing a spike in over 8,000 cases, and today, for the first time, we have seen a record spike of 9,304 cases in India. So, what is the current situation, and what do you think the governments have to look into?
Well, Deepak, chaos is the only word which comes to mind right now, given the number of cases and also the deaths. So it's almost like a double slap on the face of the Indian government, that you also have the number of cases rising, and at the same time, you also have the number of deaths. Now, so far, if you remember, Deepak, since March, when the lockdown was introduced in the country across all the states, the government was focusing on saving the lives and also running the economy at the same time. But now, the economy is back on track. People are going to their offices, yes, with restrictions and limitations, but also at the same time, one cannot neglect that in the past 3 to 4 days, it has been absolutely chaotic for the for all the paramedical forces out there. Because yesterday we reported over 8,900 cases. Today, again, 9,300 plus cases, plus over 250 deaths. So this clearly tells you that coronavirus is now not just slowly but rapidly spreading across each and every state of the country. You take a look at all the states across the country, Deepak, and you will find that yes, you have states like Maharashtra, Tamil Nadu, and others who regular, but these are states who have been registering cases at a rapid pace. But now there are other states as well. Karnataka, for example, is also rapid. The number of cases are also increasing rapidly. Yes, especially in the rural areas, and also a place like Assam, which took quite some time to register its first case, but now it is reported that 74 fresh cases have been registered in Assam, Deepak. So clearly, but let me take you through some numbers over here, Deepak. As I said, that Maharashtra is leading the list with when it comes to most number of cases. So over 72,000 cases in Maharashtra, Deepak, and out of those, active cases are over 38,000. So that means that you have 38,000 plus people who are still suffering from COVID-19, and remember, it spreads. It's a human chain which spreads this virus. So next on the list is Tamil Nadu with over 24,500 cases, and before I go there, Maharashtra has reported 2,465. I beg your pardon, 2,465 deaths, and overall death in the country is over 6,000. So you can clearly do your maths and state that over one third of the deaths which has been caused due to COVID-19 in India is because of Maharashtra. And also, Karnataka has been affected by Maharashtra with the number of people returning, or the border issues which we have with the Maharashtra, especially the migrants coming in and going out, which has also resulted in the number of cases rising in Karnataka as well, which has gone past 3,000. If I take the case of Karnataka over here, Deepak, then if you remember, between March and April, there were the average number of cases which were reported in Karnataka was close to 35 to 50. But now the average has gone past 120 per cases or even more. So this clearly tells you that, as I said, that coronavirus has actually found its space in the Indian states, Deepak. And also, carrying on with the numbers, you have the national capital with over 22,000 cases, Deepak, and out of those, 550 have already lost their lives, and recovery is over 9,000, and the total number of active cases are over 12,000. Third on the list, I beg your pardon, fourth on the list is Gujarat with over 17,000 cases. Out of those, 4,631 active cases and 1,092 people have lost their lives. Next on the list is Rajasthan, which is closing the 10,000 mark. currently stands at 9,373 cases with over 200 deaths, and then comes Madhya Pradesh with over 8,400 cases. So clearly, if you see, be it Maharashtra, Tamil Nadu, Delhi, Rajasthan, and Madhya Pradesh, you can actually go by the area and also figure out that larger the area, more the number of people, which is directly proportional to more and more number of active cases. So clearly, coronavirus has gripped these 5 major states, but also one shouldn't forget that the world numbers in particular, also Deepak, India now stands at the 7th position as far as the total number of cases of COVID-19 is concerned around the world, with over 2 lakh cases. Leading the charts is United States of America with over 19 lakh cases, and then followed by Brazil with over 5 lakh cases. Russia comes next with over 4,30,000 cases. Spain at the 4th spot with over 2,87,000 cases. The United Kingdom with 2,79,000 plus cases. Italy, and then comes India. But the worrying factor for India over here is that, like I said, both at the same time the number of cases are increasing and also the number of deaths is also on the rise. So this clearly tells you that our medical staff out there which is already burdened with the stress of the active cases already, and they have to deal with more and more cases on each and every day basis, Deepak. And also remember, if I take today's case, Deepak, then over 9,300 cases. So do we have the capacity to actually serve all those 9,000 cases at the single point of time? That is something which the states need to take a look into. I'm not criticizing it, but at the same time, you also need to take into account your capacity to serve or to make sure that all the humans which are affected with COVID-19 also get cured at the earliest. So clearly the numbers are on the rise, and one shouldn't be surprised, Deepak, if the numbers keeps on continuing. Because we are in the pre-monsoon or monsoon stage, and then also the Indian Medical Council also stated, and also the World Health Organization stated that during this monsoon season, India will hit its peak as far as the number of cases are concerned. So yes, it's a big problem of concern, and also as the restrictions have been eased out, Deepak, it almost looks like that people have forgotten that there is something like COVID-19 out there which they need to be away from, because one hardly sees, even on the streets of Bangalore also, where we have the educated society out there, also the people not wearing any mask anymore, and also not using sanitizers properly, and not even cleaning their hands, because initially when there was when the scare of COVID-19 was there, people were actually following all the norms. But now when it almost looks like that we have returned to normalcy, which we haven't, then it's clearly a cause of concern, not just for people of Bangalore, but across the country, Deepak.